Honourable Speaker, in the last provincial election, the Premier stood and committed to reopening emergency services at Seven Oaks Hospital. I tabled this article here this afternoon. So I'm asking the Premier, stand up again here this afternoon and tell us, share here with the House, that Seven Oaks Hospitals and a plan for the emergency room to be reopened will be in this afternoon's budget.
The Honourable Minister of Health, Seniors and Long-Term Care.
I want to thank the member for that really important question. The Premier has been very clear that our priority on this side of the House is to staff the front lines of the healthcare system and make sure we have the people at the bedside to deliver the care that Manitobans count on. Our government has made sure that we surpassed our target of 1,000 net new healthcare workers, 1,255 net new healthcare workers on the front lines, which is allowing us to open hundreds of beds, including at Seven Oaks. I want to reassure that member, we're starting with building the new ER at the Victoria General Hospital, and we are making sure we're working our way to Seven Oaks each and every day.
The Honourable Member for Tyndall Park on a supplementary question.
Honourable Speaker, the NDP government continues to neglect healthcare in the north end of the city of Winnipeg. This government, they used the topic of the Seven Oaks Hospital as a talking point a lot during the election, yet almost halfway through their mandate, we've seen no plans, not even any preliminary plans. Can the minister share with us anything tangible that they have done to improve services at the Seven Oaks Hospital during their time in government thus far?
The Honourable Minister of Health, Seniors and Long-Term Care.
That's a great question from the member for Tyndall Park. What I want to reassure her is that out of the 1,255 net new healthcare workers on the front lines, we have allied healthcare professionals, nurses, doctors, healthcare aides at Seven Oaks as a result. We are doing the work the previous government refused to do. We're staffing the front lines. We're adding care to the bedside of Manitobans, including at Seven Oaks Hospital. We're going to continue to do this work because we know that no matter where you live in Manitoba, you deserve to have a government that cares about you and your health care. On that side of the House, they cut services at Seven Oaks Hospital, they closed emergency rooms, and they disrespected health care workers, the same health care workers who ratified an agreement just this morning.
The Honourable Member for Tyndall Park on a final supplementary question.
Thank you, Honourable Speaker. In the last provincial election, my constituents and people who live in surrounding areas, we got our hopes up, believing that this government would not neglect the North End and the Seven Oaks Hospital. The hospital was built to be so much more than it is today. It has the potential to reduce wait times and to improve patient outcomes. Has the Department of Health done any sort of cost analysis on what it will cost in order to re-establish emergency services at the Seven Oaks Hospital?
The Honourable Minister for Health, Seniors and Long-Term Care.
Honourable Speaker, our government is doing the very, very important work of making sure that folks in Northeast Winnipeg accessing care at Seven Oaks have the care that they deserve. We're adding capacity to the front lines by hiring record net new healthcare workers to Seven Oaks Hospital and across the province. We've met with healthcare providers, leaders, and frontline healthcare workers at Seven Oaks to get their ideas, to make sure we're working together to strengthen services there. I'm happy to say we've taken real steps at Seven Oaks, and I'm always willing and happy to share with that member. And there's more work to do. I cannot wait for this House and all Manitobans to hear from our incredible Minister of Finance what is in the 25-26 budget that's going to directly benefit those living in that part of Winnipeg. We're fixing 7.5 years of damage by the previous government.
Time has expired.